Family Life Show.
So one of the key things we should talk about, the symptoms, signs of fibroid. One of the key one is heavy menstrual bleeding.
Heavy menstrual bleeding. Oh wow.
Once you discover that before you used to bleed maybe for 3 days, but now you're bleeding for 9 days, 10 days. I've even seen women, they bleed every day for a whole month.
Wow.
So once you have heavy prolonged menstrual bleeding, one of the key things that need to be ruled out is uterine fibroid. It needs to be ruled out. It's not the only cause of heavy or prolonged bleeding, but it's one of the key things that must be ruled out. And how do you do that? You go for an ultrasound, because ultrasound is one of the best way to pick uterine fibroid. So when you have heavy prolonged menstrual bleeding, it's a reason for you to check. It could be possibly be fibroid. Then the other thing, when you have abdominal swelling, when a woman, especially the lower abdomen, because it's a pelvic tumor, it grows out of the pelvic. So for no reason, you just discover abdomen is distending. I've seen women, they even say, no, I carry belly.
Okay, meaning say they show for outside.
Yes, it's coming out. Some women, you see them as if they are 9 months pregnant. It's usually fibroid. It can be as big as that.
Wow.
I've seen some that are even as big as you carrying a twin, a 45 cm uterine mass. So once you discover for no reason you are having abdominal distension, as a woman, your belly they grow,
your belly they grow.
And then sometimes if you touch her with your hand, it will be like seeing a stone then put there. It's a reason for you to suspect and go for scan and see a doctor to know what is there. And then in the very advanced stages, it could also cause difficulty in breathing, because if you are carrying maybe a baby, difficulty in breathing, difficulty in walking, back pain, weight, yes. To carry a 9-month-old baby, you know what it means. So when you carry those 2 months, you begin to have back pain, waist pain, and all of that, and you see something coming out, shooting out, and you are not pregnant, is a reason for you to suspect uterine fibroid. And then in very complex cases, because of the heavy bleeding, you begin to have symptoms of anemia. You walk small, you get tired. You discover that a little thing you do, you are panting as if you have just finished a 10 kilometer. Your eyes, your conjunctiva is looking pale, showing that your hands very white. That because of the blood you are losing from the uterine fibroid. Especially, we'll talk about that shortly, about location of fibroid. Because where fibroid is located, we also give us the kind of symptoms we will see with them.
Fibroid, it gets different locations.
Yes.
Oh, really?
Yes, because the womb is actually divided into three components. So we have what we call the endometrium. The endometrium is the inner lining of the womb or the uterus. And that is the place gone where picking they stay. Now there picking they form, they stay, they grow. The endometrium. Then just next to it you have the myometrium. That one is the body of the uterus now surrounding the endo. You get what I'm saying? Then surrounding the myometrium you have the perimetrium. You understand? That's the tiny layer that covers the myometrium. So there are 3 layers.
Just like the earth across the mantle and the core.
So when the uterus is growing in the endometrium, it usually produces heavy menstrual flow, because it's staying just at the layer that is usually shed off during menstruation. So you have heavy bleeding if it is inside the endo, the inside. So but if it's on the myometrium, it might be neither here nor there. It won't give you too much of bleeding, it might give you too much of bleeding. Usually those ones used to go very big. And then the one on the perimetrium, or what we call the serosa, that's the outer covering. Those ones usually you will not have heavy bleeding. Because they are not on the inside. So those ones can go very big, and the woman will tell you, my menses is normal, You know, and then sometimes even those ones that are outside, those ones, the women can even get pregnant, have their babies, there will be no miscarriage, because that one is right inside, outside, so it doesn't really have any problem. It doesn't cause any problem to the baby, you know. So depending on the location, it will also tell us the kind of symptoms
you
that
see.
you have.